Hello, my name is Carolina Tessie. I'm from Block G, and this is my health assessment case study number 1 video. So this is the 360 of the room. And just okay. So I'm going to start by washing my hands, cleansing my stethoscope and equipment, and donning my gloves. Hi Mike, my name is Carolina Tessie, and I'm going to be your student nurse for today. So it says in the health assessment document that you've been experiencing itchy and watery eyes, a chest rash, and a headache. Is this correct?
Yeah.
Okay, and do I have your permission to continue this health assessment?
Yeah.
Okay, so I'm just going to start by asking you a few questions. So in terms of this chest rash, when did you first start experiencing it?
2 weeks ago?
Okay, and has it spread to any other region on your body?
No.
Okay, and what, for your itchy and watery eyes, what activities are you performing that kind of inflict more pain?
After I take a nap.
Okay. And in terms of the headache, what kind of sensation comes with the headache?
Like a pounding sensation. And
Okay.
like a sharp sensation.
And how would you rate its pain on a scale of 1 to 10?
I rated about a 9.
And have you had any history of concussion?
No.
Okay. So, through the general survey, I can see that Mike's physical appearance matches his stated age, 18 years old, and there's no harsh odor coming off of him. In terms of Mike's body, it's symmetrical on both left and right sides, and I do not see any obvious physical deformities, and he maintains good posture. In terms of Mike's gait, earlier I noticed when he walked in that he had accurate foot placement, and his arms are swaying back and forth symmetrically, and there was no leaning or limping to one side. In terms of Mike's mood, he seemed to be pretty relaxed, but he keeps fidgeting with his hands and his eyes, and he seems a little uncomfortable because of his symptoms. Mike maintains good hygiene, he's dressed appropriately for the interview, and he tries to maintain eye contact with me when he can. Mike, in terms of being respiratory distress, he does not seem to be in any respiratory distress of any kind. He's not breathing heavy, there's no nose flaring, and he doesn't grunt or gasp while he breathes. And in terms of being alert and oriented, Mike, can you tell me where we are?
We're at the hospital.
Okay, and who are you with?
A student nurse.
Okay, and which month are we in?
February.
Okay, so this tells me Mike is alert and oriented to time, place, and person. So, Mike, now I'm going to begin by palpating and inspecting your head. Is that okay? Okay. So, first I notice that Mike's head is in accurate shape and size for the rest of his body, so it's proportional. And as I palpate the head, I do not notice any bumps or lumps or any swelling, which is normal findings. And then I go to the hair, and as I do that, Mike's hair there's an even distribution of black hair throughout the head, and there's no signs of infestation. And as I look at the scalp, I don't see any lesions, cuts, or bumps, or any masses. Okay. So now I move on to the face. Mike's face is symmetrical on both sides. His skin tone matches his ethnic background. There's no involuntary twitching or movements, and Mike's face, when I palpate it, there's no signs of edema or swelling, which is good. Now I'm going to move on to cranial nerve number 7, the facial nerve. So Mike, I'm going to ask you to smile for me, frown, raise your eyebrows, puff out your cheeks, tightly close your eyes. Okay, so this tells me Mike, cranial nerve number 7, the facial nerve is intact. Okay, So now I'm going to move on to the eyes.
Mhm.
So starting with the eyebrows, Mike's eyebrows are symmetrical on both sides. There's no scaliness or scarceness, which is good. And with the eyelashes, they're even distribution on both sides. And Mike's eyelashes, both on upper and lower eyelids. Okay, starting with the eyelids, Mike, close your eyes. Okay, so close your eyes, yeah. So with the eyelids, there's no cuts or masses on the eyelids, which is good. Now open your eyes. Okay, so there's no signs of ptosis or lid lag, and the eyelid rests above the pupil and covers a bit of the iris, which is normal. So now I'm going to inspect the sclera, and the conjunctiva. So Mike, I'm just gonna ask you to look up while I pull down on your lower eyelids, okay? Okay. So as I do that, I notice that the sclera, which should be white, is a little bit pink, and the conjunctiva, which should be translucent and a pink tone underneath, is red. So this might indicate why he's having these problems. I also notice a little bit of discharge. I notice some excessive tearing and some swelling. So, Mike, now I'm going to examine your pupils. So while I do that, Mike, just look at me for a second. So just look straight ahead. So Mike's pupils are dilated about 5 millimeters in diameter, which is a normal finding. And yep, 5 millimeters in diameter. So they're clear, they're not cloudy, which is also normal. They're equal on both sides, and there's no anisocoria present. So now I'm going to do the direct consensual light reflex test, if that's okay. So I'm just going to shine a light in your eyes and watch your pupils constrict. So I'm just going to provide a bit of darkness. Okay. Ready? So look straight ahead. Look at me. Okay, so it constricts. Look at me. Okay, it constricts. Now I'm going to do the same thing, but watch the opposite eye. Look straight ahead. Okay, both constrict. Both constrict. Okay, so now I am going to do the combination test. So just gonna follow the pen and I bring it towards your face. Okay, so both eyes converge inwards, which is a normal finding. Now I'm gonna test your lymph nodes. Just look at me. Okay, starting with the preauricular, the postauricular, the occipital, base of the skull, the jugulo-digastric, the submandibular, the submental, okay, and the superficial cervical. Turn a little bit. The posterior cervical. Relax your hands. The deep cervical chain. Okay, and the supraclavicular. Okay, so as I do that, I do not notice any abnormalities. Mike's lymph nodes are bean-shaped, they're movable, they're soft, non-tender, and they show all normal findings. So now I'm just going to look at Mike's chest rash. So as I do that, Mike's chest rash is red, like he stated, and as I palpate it, it's flat. It's not elevated. It's about 5 centimeters in diameter on the pectoralis major, and it's yeah, and there's no odor or secretions. So thank you for listening to my health assessment.